There you go. There you go. There you go.
That was wild.
Ooh.
When you're upright, it should be relaxed.
I know, I see this on the videos and I'm like, oh, I wonder what it feels like.
When you bend
Supple.
forward, it gets. I don't like these speed bumps. These are all speed bumps on my highways. Who put this?
I know.
Who put this speed bump right here?
Who dare put these there?
Look at that thing.
I
Jeez.
know.
Who's it and what's it's galore? You want to think about that?
I got 20.
Show me how you've been using this. I'm gonna
Yeah.
critique you a little bit.
Okay,
spot a little
good.
bit,
Yes,
but
I
show
was
me what
curious.
you've been doing. You've been.
So I go, let's see, and then I kind of, so I try to keep my forehead back like you say in your videos.
Okay.
And then, let's see where my shoulders are. Okay.
Okay.
So that's what
I'm glad
doing.
you're here. We're way too low.
Oh no!
It's okay. We're way too low.
No!
It's okay. What's the major thing that you want me to? What do you want me to hit the most of? Because there's a lot of stuff I can hit.
There's
here,
a
but
lot, yeah.
Go ahead.
Main thing I would say is like mid-back tightness and then kind of like lower cervical.
Okay.
So I started getting numbness down my arm
Okay.
back like last March. And so watching your videos, I knew, I was like, oh no, there's probably a
Where
dip.
specifically are you feeling
So
this?
ulnar left upper extremity. So I usually get it in like small and ring fingers and
Okay.
it's constantly there.
Is it there right now?
Yeah, it's a little buzzy. There are certain motions. I've been told I might be TOS
Sure.
because of there are certain motions,
Sure.
like when I put my arm overhead, but I don't think it's TOS. I think
Sure.
it might be coming from like my lower neck.
Right. So where exactly? So pinky,
Pinky, ring finger,
just those two.
and then it kind of goes like ulnar.
Okay. On your MRI, I really don't have any. I mean, the ulnar nerve would be affected by this nerve root
Like
right here.
C8, T1.
Right, C8, T1 right in here. So I don't have it. You have a disc injury up at C3. So there is a, the spinal cord here, and that's the disc right there, and then you have, that little gray right there where the actual ligament's being lifted up by the disc underneath that's pushing out on it.
Okay.
So this would be more the upper neck pain.
Sure.
Neck,
Yes.
and then when you're having disc injury, the muscles are going to want to protect.
Correct.
So you're going to have guarding around the area that's injured.
Sure.
And then there are evidence that the lower neck discs are starting to age quicker than a 33-year-old's lower neck should be. So the main other thing that we see here is that the neck is straight. I know they had a collar around you, but the alignment is such where there's too much weight all the time on the discs.
Correct.
So we want to teach you about trying to get the weight off the disc, put on the joint, restoring the curve to your neck.
Correct.
And the alignment not being correct also creates a lot of the tension. So when your head is forward or the neck is straight, the muscles are working harder because the alignment's not right. So we have some alignment issues. The thoracic outlet is just the funnel where the brachial plexus goes down through your arm, and the brachial that funnel is almost always to some degree compressed on all of us because of our alignment and because of our posture in life. You have three components. You have the rib and the upper back going upwards. You have the bones in the neck going posterior, so which is what we can see here, and then you have also the tissue that the nerves are sitting in. Mm-hmm. So we're going to clean. That's where you see the marks and the bruising. We're going to clean out the tissue that the nerves are sitting in, and so some component can be the rib being up, but since you have scoliosis, I'd be more curious when that if it's functional, because I know you said you had ankle injuries also. So those sometimes you can create a scoliosis because you're in pain, right? So you sprained your ankle 8 years ago, and then you put your weight all on your left ankle, and now you're creating a scoliosis because of pain. Or, if you noticed it when you were a teenager, then it's more of a structural scoliosis. When you were growing, it was developing. And so it's kind of, but I could see some evidence of the scoliosis and the tilting on that MRI. How did you sprain your ankle?
It was at the beach, and I was running. I didn't see a hole, and I think it supinated. Yeah.
Got it. Okay.
Yeah, that was, and then I think the same thing happened last year on my left where I supinated. So it's constantly kind of clicking and just feels like a little unstable. But yeah.
The biggest things that I do right now is that I want to go through your spine and see how it's moving as a team, and how we will say difficult it is your spine to go into the alignment that it should be in.
Yeah.
I believe a lot of these issues come from when we're not where we're supposed to be. So our ear should be over our shoulder, shoulder over the hips, hips over the malleoli.
Yeah.
And when our body starts to stray from that normal posture, a lot of even the tension in your back can be postural. Also, it can be because of injury, and then you're tilting, and so
avoidance,
getting rid of the reasons for why you're tilting is what we needed to figure out.
Right.
Along with not only cleaning the tissue and helping get some of the soreness out of it, so that it can then relax.
Yeah.
So let me have you stand up.
Absolutely. I'm so excited. Yeah, definitely higher up on the left.
And have you injured that clavicle? You said or no?
No. So this, I always assumed it was because of the injury from that the person in 2015. But he injured me after I couldn't turn my neck without moving my torso. It got so tight, and
he jammed
it was guarding.
Joints.
Yeah.
So not only do you should never thrust into someone's lower neck. It's never indicated. You sprain your neck and then you have trouble. It's just not a good situation to put somebody through. All right, left hip's a little high. Left ear. So you think you injured that one and you're standing more on this side now.
So I do tend to stand with on my left side.
That kind of tilts you to the...
Yes, I catch myself, if I'm in the OR or something like that, I'm tilted. I definitely put more weight here. So I've been
Does it hurt to stand on the right ankle?
It doesn't, no.
But
I think I've just kind of compensated, yeah.
All right, keep looking straight forward. I'm looking fast, You're fine. We're dealing with about an inch and a half. We got to get that head back over your shoulders. That's going to create tension here all the time. When your body, here we go. When you're upright, it should be relaxed.
I know. I see this on the videos, and I'm like, oh, I wonder what it feels like.
When you bend forward, it gets tense because you're not. And that's part of it. Your posture and work requires you to be forward.
Right.
So we need to learn some things at the end of the day to counter stretch.
Right.
So we don't your body's remained forward and hasn't reset back to home.
Yeah.
Maybe starting back.
I have been using the Denneroll, and I've gone up to 20 minutes.
Where have you used it for me? Show me where you've been using it.
So I use the cervical Denneroll. I don't have the thoracic yet, but I have been using it for 20 minutes, as you've been saying.
How many times have you done it for 20 minutes?
Probably upwards of 20 for sure. But I think in the last couple of weeks I've been slacking off. I was definitely doing it probably for 2 months, doing it pretty consistently.
Let me check. Take a deep breath. Here we go. Exhale. I got you. It's okay. Let it go. I got you. There we go. Deep breath in. I got you. Let the jaw relax. There you go. Yeah, deep breath in. One more. Exhale. There you go. Very nice. All right, let me just finish side facing. I got you. Exhale. You're fine. There we go. I got you. Here we go. Breathe. Exhale. Is that for me? Good. Very nice. Very nice.
C maybe? C plus?
You're fine. No, no F's yet. No F's yet. Not handing out grades yet, but nothing's failed. Deep breath in. Exhale. Yeah, face up for you. Okay.
Definitely always doing this, almost as if I need to
click those joints in the back.
Always, I'm always doing that.
Yeah, that's gonna be, Sam, the alignment's not correct. The joints get inflamed. The air bubbles, tension build up in there. Give me 1 second. Let me see here. The atlas is really out to the right here. So the right atlas. So that has to do with that left. So what's happened is the right side of your neck has an injury. Probably, you said you were T-boned from the right?
We were actually T-boned from the left.
T-boned from the left, so you got
whipped.
Like I said, there's an injury to the right side of your neck, either through the first collision or the whip or the lash, which caused essentially the right side of your neck to be avoided. And now what's happened is, if you injure the right side of your neck, your head will tilt left to get away from it.
I always tilt this way, yeah.
So, and then what happens is you'll make yourself dizzy by tilting your head, and so the shoulders will then tilt as a way to, we call it a riding reflex. Your eyes will always go to the horizon.
Right.
So I believe a lot of your tilting starts right here on the right side of your neck being out, and that we actually, when we're on the neck Denneroll, we actually want to be back and to the right a little bit to get we'll be back into the right to compress the right side.
Okay.
And I'll show you that in the end. Loosen this top guy a little bit. There we go. Real gentle. I got you. There you go. There you go. Very nice. There you go.
That was wild.
Ooh. It's like ringing.
I got your head. Relax here. Relax. Very nice. Very nice. Good.
We'll call it a day after this.
It's just a quick way to the reason we do that, people are, why you gotta do that to our neck?
Yeah.
We're trying to reorder the firing order, whereby, so the nerve that causes the symptom you have in your hand is coming from your lower neck, C7, C8 area.
Yeah.
So the upper neck injury that I see, is more be upper neck headache pain you might have,
yes,
inflammation of your upper neck. But in order to alleviate that, the numbness is a more serious symptom, and so to alleviate that, we need to get your upper neck moving better.
Yeah.
Get the curve back in your neck. This tilting going on is going to create. Let's see here. So which hand is it again? The left hand?
It's the left. Yeah.
Right. You see how it's going to be the left because you're tilting away from your right.
Right.
You're going to pinch. You understand? You're pinching the left lower.
Yeah.
So part of alleviating it is to try to get your head over to the right.
Right.
So it's going to be back and to the right. There we go. And then not.
Yeah. Oh man, I can't tell you. I used like a little lacrosse ball, and I'm just like on that all day, but it's so hard sometimes.
Get it? Yeah.
I've gotten all the tools you have. I'm like, how can I release this thing?
It's tough. Once we get it adjusted and we will say we can keep this limber enough that you can stretch properly.
Yeah.
What happens is if it gets super tight, the Denneroll isn't going to be very effective.
Right.
So we're going to see if we can get you
It's
down
a
the
little
bottom.
in vain. Gotcha.
Right there it is. Yeah.
Hi, old friend.
Old monster.
I know. I'd prefer if he wasn't there. But he doesn't want to leave.
No.
So I'm just thankful that there's no disc injury. I was so worried.
Not in the lower neck.
Not in the lower neck. I was so worried for that.
Yeah, it's probably more the joints inflamed.
Okay.
Or the tissue that the nerve is traveling through is inflamed.
Right. That's what I was hoping for.
Yeah, I don't. There are injuries that can be there, but we can't see.
Yeah.
The joint, for instance, isn't perfectly visible on the MRI, right? So you have joint injury, and it's just not, the image isn't HD quality enough to let us see, joint effusions. A large amount of fluid, yes, but if it's just some inflammation, it's just not perceptible. And so this is what I mean by cleaning the tissue, getting any soreness, any tension out of the tissue.
Yeah.
All right.
So what about the C3 injury? And another one with the bone. Is that gonna?
Right, there's just too much weight on the vertebrae. The vertebrae on the front, has to do with her work and probably that car accident in 2003 where the joints are primarily injured in a whiplash, and then as a compensation to having that level of joint injury, your body then rounds forward. And that happened when you were growing. So you're a teenager, young teenager, and so in your formative years, you had a pretty massive injury, and then that's how your body healed, was crooked kind of idea.
Yeah.
And now you sprain your ankle, and that feeds it, and then you heal incorrectly. And so we have multiple stages and levels of injury, healing, and avoidance. Yeah. And that's, kind of now we're at this end result of here's where we are. And so this is what I mean by this channel right here.
Yeah, oof, it's like it goes right here to my head. And lately, the last 2 weeks, again, I'm so grateful I'm here because the last 2 weeks, I've had this insane amount of just tension, headaches, and that isn't actually normally common. I'll have headaches every now and then.
Okay.
But it's been every morning when I wake up. It's almost as if it knew I was coming in. It was like, help me.
That's from this tension up here.
Yeah, it's recreating it for sure.
Alleviate this.
Well, I'm a physician assistant, and initially for 2 years I was working in hand, wrist, and plastic surgery, and so it was a lot of on my feet in the OR, retracting, suturing, for 10 hours straight.
Okay.
Not 10 hours straight, but you know what I mean, in the OR, just all day on my feet.
Yeah, the only way to change posture is through stretching. If the rib's out of place, there is no. It's a fairly large fallacy. Chiropractors will say it. Let me push the rib back. It's kind of.
Yeah.
What we're trying to do is, we will say, you're trying to loosen up the area so that the stretching can actually change it.
Yeah.
That no adjustment other than maybe for 10 or 15 seconds can reposition a bone.
Yeah.
So the purpose of the adjustments is to loosen what's tight and to leave alone the loose areas so that the stretching ultimately, for instance, if your head's forward, of course the ribs in your upper back are going to be elevated because your head's forward.
Yeah.
So it's there's nothing novel about saying that the ribs are elevated.
Yeah.
I just told you that when I looked at you from the side, your head's inch and a half forward.
Right.
Ribs will be out of position because your head's not in the right position. So we call it coupled motion. That the ribs are going to elevate. So if we want to ultimately bring this rib down, we have to work on stretching and getting your head back. And it's not just the neck Denneroll. We also need to get the chest in and loosened up so that the head can actually retract back.
Right.
If the chest is rounded forward, then you actually can't get the head back. So sometimes I actually start with the thoracic area to loosen up and push these areas down so that the head can actually come back. Yeah, a little bit right there, but here.
I'm trying. I'm trying to help myself,
good,
but
no. Yeah, you're ready. You're pretty much ready for this stretching. If I can show you all the different tools.
Yeah.
I think a lot of it's going to be.
That's encouraging.
Yeah. There we go.
If only I'd gone in to see you when the accident happened.
Our world doesn't guide us. We live in an avoidance world, not
totally
one that really guides us into understanding what happens to the body when we go through a trauma like that.
Yeah.
How the possibility of healing crooked happens. And to me, there's really two injuries when somebody has a whiplash. You have the injury, what gets injured during the car accident, and then you have the compensatory injury from healing crooked, and then that actually is a much larger injury.
Yeah.
Something like 80% of the totality of the injury is how you healed crooked versus even what happened during the accident.
That's so wild.
So if you can nip it in the bud, if you can pull the weed right when it starts to grow, it's easier to take care of versus letting it grow into a giant tree and now we're trying to deal with it. But right there, a little mark right there on that kind of gristly, grainy.
Oh, gristly is the right word.
Gristly,
Yep.
Very nice right there. Very good.
It's I'm grateful for your channel, honestly, because it's so hard and it feels so lonely sometimes to navigate when you're going through issues, because you go to these different providers, and I know I'm guilty of it too. I try to be cognizant when I advise my patients, but sometimes you get stuck in this prescription, and we're not open-minded to, okay, well, maybe there's something else going on. And so when I hear you educate your patients, I'm that's what it's about.
So for the hand, I just straight traction. You just straight. Don't be twisting. Don't be popping downwards. Just the health of the hand does come from the nerve. It's kind of like if there's no blood flow to the hand.
That's my worry because of the nerve stuff. I'm worried that.
Well, to some degree, it's gonna impair it's like the UPS shipments or the electrical, power to the tissue comes from that nerve, and so there's gonna be a level of atrophication. The tendons, the joints will atrophy.
Yeah. I feel that a lot going now for my shoulders. Didn't used to be crepitus in my shoulders.
These all feel pretty good. I don't have any large amounts of restrictions.
That's encouraging.
Joints, so.
Okay.
Works here. Press back into your elbow. Here we go. Just press back a little bit. Here we go. We'll move a little bit.
Roll step.
Really good.
Okay.
All right. Press back a little bit. Here we go. Good. Okay. 1 second. We're getting face down. I was going to see that. I'm going to check your ears. Is that okay?
Okay. Yes.
We'll do this early today.
Yay.
All right. Go ahead and tilt to the right for me. There we go. And tilt to the right.
Yes.
Good. Tilt to the left. There we go. And then go ahead and tilt. There you go. Nice.
I'm assuming my mid-left back is a little bit raised.
Got a couple things. You have just two. It's really left and then right here. So you have right in here. We gotta get all this down.
Yeah.
There. So the channel right here. This is, we want to get this.
That spot right where you're at.
Mm-hmm.
Oh my gosh.
Well, that's where the nerve's getting pinched.
Yeah.
Right in here.
Yeah. Oh my gosh. I try and try and try and I just can't. It's not the people's elbows, so.
That's right.
It's not. It's not as effective. Oh, I know. That's the spot.
Let's work on it. See if we can. And because there's pressure on the nerve, of course, the muscles are all tight because they actually get tasered. They're all trying to guard.
Yeah, for muscles.
Oh, boy. Way too restricted right here. click right in there.
So this is so funny. Whenever I watch your videos, I'm like, oh, I need that. So I'll like go and I'll take my little lacrosse ball and just try to find these little restrictions. But
yes.
It's hard to get it all.
Right there's one.
I think I found one like down here too, and then there's one on the opposite side.
Let's get them all.
It's like an Easter egg, huh?
Yeah, you had an already inflamed lower neck, and then somebody went and, thrust right into it. It's not a good situation to be in.
No.
Let's not do that. Let's leave that lower neck alone. Let's focus on the upper back, the upper neck.
Yeah.
And, just kind of poke a finger into a wound kind of idea. Yeah.
I didn't know any better at that time.
Okay, no, it's not your fault.
I was like, I trust him, and I also, the sound of a reverse rib being out, I'm like, I don't want any ribs out.
Sure.
But I should have said no, and I think...
No, it's not your fault. Practitioners are responsible for taking care of their patients.
Could it be that the lower neck is the one that kind of throws off my hips too?
Absolutely. Yeah.
Okay.
The head tilt's going to create a domino effect all the way down to your feet. So I think this is functional. I don't think this is a true scoliosis. I think what she has is injury, healing crooked into avoidance. I don't believe this is what I have a 19-degree kind of structural scoliosis. It happened when I was a teenager.
Got it.
It kind of happened at the same time though, because your accident was when you were 13, right? So if your body was going to create a scoliosis, that's when it would happen, and then you got traumatized. It's created so it's kind of hard to separate. But if I just from what I'm feeling, this doesn't feel like a typical structural scoliosis.
Got it.
This feels like there's a symptom, and your body's trying to hot potato and move things around to find there we go. That's a position of comfort.
Yes.
And so once we, how do you fix it? Well, you get rid of all the things that make your body need to avoid, right? And once there's nothing to avoid, your body will recenter itself.
Sure.
So being able to be adjusted anywhere, being able to be massaged anywhere, and then loosening up the tight areas, and that will mechanically take stress off the ones that are already stressed out.
Right.
Bringing your body back into what we call the ideal alignment, where there's the ears over the shoulder, there's a curve in your neck, curves are restored to your back. And I'm glad I think you definitely are ready to use the neck Denneroll. So I think, it's just, I want to make sure you're using it correctly, the right position, and we'll check that in a minute. I don't like these speed bumps. These are all speed bumps on my highways. Who put this?
I know.
Who put this speed bump right here?
Who dare put these there?
Look at that thing.
I know. That's what I'm talking about. Who put that there?
That is.
It's gnarly, right? Oh my gosh. It was prime for you.
You waited for me.
Yeah, it's true what you said, like the whole hot potato business.
Yeah.
Because I used to be very symptomatic on my right side. And so I was like, what's going on my right? And then we switched over to the left. It's weird. So I'm just like, which one is which? Which one started first, and which one should I attack first? And it's just that like migrating pain, which is so frustrating.
Gremlins, I call it. Yeah, the body moves them around.
Yeah. I'm curious too, like, is all of this also, there's probably a play in terms of like gut issue with this because of the nerves that innervate the gut.
Absolutely.
Because I have SIBO, like I have this like unrelenting kind of gut stuff, and I'm like, gosh, it's probably because
100%
of
right
the
here.
nerves, right?
Here. The nerves that, the celiac plexus are
correct.
Nerves right in here.
Yeah.
And
so
your small intestine right here.
Yeah.
So getting your spinal health improved.
Will help that, hopefully.
Yeah, right here.
That's what I was hoping for. Your elbow said challenge accepted.
That's right, let's get it. Very good.
There's people that give you massages and it's just like the very gentle one. And I'm like, you put some like back into it, you know?
That's cute.
Yeah, that's real sweet, but it's like, I need something more. my philosophy is if this is a temporary pain so I can get relief, like I'll take it. That's the stuff I can't get.
Mm-hmm. Yeah, it'll auto level too as we're stretching. So we're going to use the thoracic Denneroll in a minute, and the side that's higher, the left, will get leveled out as you just stay in the middle. Does that make sense? Because the left side, you might feel crooked on it, but as your back levels to it's an auto centering, auto leveling device.
Yeah.
Right. So you don't have to. You can like with your neck, we're going to have your head turned to the right a little bit to help speed it up, but you don't have to even do that. Okay. It's just a way to. Your spine is supposed to be in this position, and so you just kind of press it into the mold, and then over time your body will, assume the right position and get normalized to that position.
Got it.
But it's like clay; you can't reshape hard clay. It won't go into the mold properly if it's all rigid.
Right.
So the reason I have an office is to, otherwise I would just get on QVC and sell Dennerolls. Why have an office? Well, you can't put lay people on Dennerolls because they're just going to bend where they're loose.
Sure.
And you have the potential to, hurt people because they're not going to bend evenly. And
right. The whole analogy of the paper fold.
Yeah. You're going to bend just where you're in that same crease.
Yeah.
Yep. What did you find?
I know. Treasures.
Oh, treasures.
I'm going to get an up-close shot of you guys holding hands.
She's drawing blood.
Like, oh gosh, the nails are digging into my pants. I don't think I was holding too strongly. I feel like the Little Mermaid. Like, wouldn't you think my collection's complete? Like, I have so many little speed bumps. Yeah. Just collecting these little buggers.
The girl who has everything.
Oh my gosh.
It's all Brenda's fault.
That's right.
Got gadgets and gizmos.
Lord.
That's right. Got who's it's and what's it's galore.
Lord.
You want to think about us?
I got 20.
Connie, you don't even know.
But who cares?
No big deal.
I got more.
Yeah, that's
I brought the raspy voice with me today. That just got super tender there too, like serratus and
Your shoulders being forward, this is your posture here.
How's it looking there? Does it look like I got run over?
There's definitely some, there's
It's like
inflammation that needs to be cleaned out, yeah.
Yeah.
I mean, I've seen, there's definitely worse. I think you've been doing a good job of drawing attention to it. I think you're on the right track, and let's keep you going down this path of getting your back healthier.
Yeah, I've been trying to get that like grassed in stuff like pretty regularly, so she's done a great job of like loosening things up.
Yeah, I can tell you definitely it's not the first pass.
Yeah.
Carpet cleaner kind of idea.
I wanted to make sure I did that before I came in, so it was like I get the most out of the treatment.
Mm-hmm. No, you got all the surface layers are gone.
Yeah. It's like the deeper stuff that needs.
Right here.
Oof. Oh my gosh. That is something.
So you lived in Hawaii how long?
I was only there for like 3 years. My alarm, my kind of internal alarm goes off every 3 years because we moved every 2 and 3 years. And being my dad is in the Navy.
I got you. There you go. I got you.
Wow, that was nice. The bow. I wonder what that felt like.
Usually those should have already moved, right? That's part of is that you have your body is out of position, and I have to take you into extension to even get that to move. We're gonna do a real gentle. I'm gonna see the top.
Yeah. Okay.
Put this arm on the top. Put this one down.
Oh, that's right.
Perfect.
Yes.
Keep that forward.
I know better. I've watched you so many times.
We're just gonna stretch for a second before I adjust you. I just want to see how you handle this arch. Relax your chest.
Okay.
Relax. Has that hurt? Did anything happen?
No.
Here we go. You okay?
I think that was my shoulder.
Shoulder lift?
Yeah, that's fine.
You okay? Breathe. Here we go. Exhale. Good. There you go. There you go. Good. You okay?
All right.
He's pretty good. There we go. Good. All right. See if I missed anything. After the bow move, this is like redundant a little bit.
Yeah.
So we already compressed everything.
The bow got it.
Yeah.
It's quite an impressive move.
Mm-hmm. Ha!
I should be like, go back to California. Can you do the bow? They're like, what?
Watch this video. That's an,
Yeah,
now
yeah,
you're
yeah.
Like, oh my.
Can I request of the bow?
Sorry, my dad taught it to me.
I love it.
It's not exactly a Palmer
Yeah.
adjustment. The joints last, well, a lot longer than the discs are going to last. And so
Yeah.
why are you putting all the weight on the joint? Because
Right.
they're not the bottleneck. They're
Yeah.
not the thing that's going to limit your ability to move and function when you're 80.
Yeah.
Disc health is.
Mm-hmm.
And so by keeping the weight on the joint, we remove it off the disc, and that allows your spine to slow the aging of the cartilage, the tread on your spine. And so when these joints get injured and, well, they have a lot of feeling and they get injured in falls and whiplashes, your body compensates, it rounds forward. Now you get pressure on the discs, and then inflammation of the joint, and then hits the nerve. And so we want to keep your body upright. Don't let your body avoid. It's going to be our prescription. Wow, these toes aren't doing too good, though.
They're what? They're jammed.
They're hammering, yeah. Yeah. So this guy specifically, this guy, feel the difference? This guy right here. Whew. So he's starting to come upwards.
Oh,
you want to kind of traction and curl. So
Okay.
take the toe, pull in this direction. Don't ever take your toes and go like that.
Okay.
Always go
Down.
this way, stretching the top.
Okay.
You know, the hammer toe, the drop metatarsal, bunion, all those types of things happen because there's too much weight on the toes, and this is along with the back.
Yeah.
You understand, having back injuries throws the weight to your toes, and then
Yeah.
the toes start to shift. So that's part of what we're seeing here. I got you. All right, hold on the table for me, bow your head for me.
All right.
You're so tiny. I got you. Here we go. There you go. Good. There you go. Very nice.
They're all jammed too.
Yeah. Well, too much weight on them. Yeah.
Yeah.
Yeah. You've had too much weight for too many years
Yeah.
on the toes. Yeah, that's good. Good there. It's just.
Holding.
There we go. Very nice. Very nice. All right. Let me have you come over here for me. Right over here.
Yay!
Do you know what?
I'm a Rice Krispie treat.
Do you think it's the white one? I don't know the rest of Dennerolls, but do you know? What
I have
color
the
your
white
neck-
one.
white neck
Yeah.
one?
For my neck.
There we go. Perfect. Arms up if you can. So bend the knees. So the idea is to get a downward tissue pull. That's good. And relax. There you go. Relax now. So you make that contact and you get a downward pull on your spine. Does that make sense? So it feels like it's kind of sliding down your back.
Okay.
And then try to relax your arms. If it's too, you can have them over here, but you want to try to figure out where you can hang out the longest period of time. You're going to work all these angles, 9 and 3 and noon, but you want to, it's okay, yeah, you're fine. We got to work on, eventually it's just holding it, see if you can figure out the position you can hold.
Okay.
And you just kind of relax your arms, relax, and you want to kind of hook the rib. So the way to put your rib back in is to take it and hold it down. Do you understand? It's really the rubber bands that wrap your spine that determine your posture.
Okay.
If your back is all bruised and stiff, yes, it needs to be limbered up so that this works.
Yeah.
The effectiveness of this Denneroll and actually changing things, if it's a piece of concrete, it's not going to work.
Yeah.
So you have to be made limber, which you're not a newbie here. So we got a couple more visits to actually get you loosened up. To me, would be the idea is to have them just adjust your back a little bit more, and then molding. You're ready today to start molding, and your range for the yellow guy is between the shoulder blades.
How do I know the exact position to put it in?
You're gonna work all those
So
areas.
all the way down.
We're gonna work all.
Okay,
so
got it.
you set up a little bit. You could go a little bit lower.
Okay.
It's in between, like center, in between the shoulder blades.
And then pull down.
No, upwards.
Oh, up.
You're going to slide upwards.
A slide up. Okay.
It's going to slide downwards.
Got it.
So it's going to feel like the tissues, see the tissue can move. You want to have a downward tissue pull.
Okay. So I slide up. And then
you're going to slide up so that it's kind of it's going to be tractioning downwards.
Gotcha. Okay.
You'll find around 15 to 20 minutes is the toughest time to stay on because your body's actually changing. The ligaments are actually what we call ligament creep. They're stretching.
Yes,
You'll
I definitely feel that.
Open
at
up.
20, yeah.
And that's where you got to keep trying to access that. That's where posture change occurs. And if the hands start going too tingly, then put them down on your belly. But we want, and we're going to go over this white guy in a second because to me, to help your neck, we need to go back and to the right to open up that lower neck on the left. And that should make it harder to. They're kind of like dominoes, or this has to go in before if you put this back too far, you're gonna hit the nerve. So you got to bring this in a little bit so this can come back. It's like you don't just do the neck for 3 months. You kind of do the back for a little bit, and then you do the neck for a little bit. They're all gonna move together as a team.
I see.
To get you upright. There's another guy, a lumbar guy. Do you have a foam roller? Do you use a foam roller at all?
So I had actually messaged you with the ridges, like that ridge roll, and I was like, which one is that? And I got it. So I do that, like I roll it out. But I have been spending most of my time on my neck and my mid-back, not much. I do have like hip stuff. It actually feels better like after the adjustment.
Yeah.
But that's why I roll out like maybe the SI joints. But
the area that I would focus on is where that one lump is on your left side. That would be, and you can actually use this guy on it. That kind of middle back. It was right around here.
Right here, yeah.
That spot in there does need, it's growing. So we want to, it's probably 10 years behind your neck, but it's a spot that's going to need to be cleaned, like a tooth that's got a cavity. It's starting to form in there.
Yeah.
That left side, middle back. And you can use this guy on the thoracic guy on it. The thoracic guy is basically this guy cut in half. So let's pick a side, just roll off to your side.
Okay.
And then roll back on your back. There you go, easy. How'd that feel? You okay?
That Olympic land.
Yeah, you okay?
Yeah, I'm good.
I'm just gonna show me how you've been using this. I'm gonna critique you a little bit.
Okay, good. Yes,
show
I was
me what
curious.
you've been doing.
So I go. Let's see, and then I kind of. So I try to keep my forehead back, like you say in your videos.
Okay.
And then let's see where my shoulders are. Okay.
Okay.
So that's what
I'm glad you're here. We're way too low.
Oh no!
It's okay. We're way too low.
No!
It's okay.
Oh gosh.
Let's not do it.
Am I on the injured area?
Yes, ma'am.
No!
Yes,
okay, I need to be on C.
You're pissing off the injured area. let's not do it like that.
Well, I'm glad he came in.
That's why I get paid the big bucks. You got it right on C7.
Wait, where do I have it on?
You have it right on where the nerve.
Of course I would.
All right, let me show you.
Wait.
I got you. Well, I got you. So okay. So we're gonna keep it middle upper neck. Kind of. I almost want it as high as you can, but your head still goes over it. So it'll have to slide. It'll have to slide down a little bit to get your head to go over it. So I'm going to show you the wrong position. Another wrong position would be the relax. I got you. This would be a wrong position also.
Right.
You're saying your head's not over it. We're in the upper neck, but you're not curving your neck.
Yeah.
So we're going to do it a little bit lower, and then you'll take your hand, either one, and then you'll put it on your forehead, and you'll press, and it'll slide a little bit. That makes sense?
Yeah.
To get it to go down a little bit. So we're about, then relax. So we're about.
What level is this at the moment?
We're trying to be at C3, C4.
So where the disc injury is?
Well, that disc injury, that isn't going to cause, I believe, there's an injury in there from whatever, a car accident. I don't believe that's going to be a limiting factor for you.
Okay.
The lower neck, the injury, the joint injury or the soft tissue injuries in your lower neck, those will lead to things that the medical world is going to be interested in.
Yes.
That disc injury in the upper neck, I've never seen anybody ever operated on that. I believe that to be more of a kind of an incidental injury that's in there, that it's there, but I don't believe, I think you're going to live your whole life with that and that not cause much of a problem.
I see, okay.
That would be my opinion on that.
The bigger issue is the
lower neck. Correct. That's going to be that's going to stop us.
Yeah.
Ed, I'm dying here. So I want to keep this, and even for the treatment of that disc, it's still, we need to put it on it to open up and depressurize that upper cervical. So by arching your neck back with it in the upper cervical. We're going to be opening up, and that disc will vacuum effect. We call it. It'll get like a straw sucked back towards the front.
Okay.
And it needs to be kind of middle upper neck.
I think it's because I was so young when it happened that the pressure from the car accident. Somebody told me that they're like, your injury is not normally where you see a car accident injury, because I was probably small in the car, or is that true?
Not only that, but probably that's where your neck was moving. See, when we're young, the upper neck is the loosest part of our spine.
Yeah.
And when we have injuries, sometimes that's where the forces go, is the parts that are moving because you were moving properly. Now, as a result of that, you spent the last 20 years not moving properly.
Yeah.
But the force definitely went into your upper neck, which, you know, that was the part of your neck that actually was moving. I don't think that's going to be a thing that affects you long term. I believe the lower neck joint inflammation that we can't exactly observe on the MRI, but you might be aggravating by putting the Denneroll too much in the lower neck. So you're like that paper folding analogy. You have the Denneroll right in the middle of that fold. So you know, it's a pretty powerful tool, and it will take whatever's already moving, and especially if you put pressure on it, it'll make it bend more, and it can hypermobilize an already mobile area, right?
Okay.
So we want to be careful. You should be feeling like, you know, pressure in your upper neck, potentially some soreness in your upper neck. That's okay. It might go a little warm or tingly in the back of your neck. That's okay.
Yeah.
But I want to keep it away from your lower neck. And,
Gotcha.
And as long as, like I said, your chin is, you know, not tucked down and trying to go up a little bit, that's perfect. Yep, you're good. Good.
So if I take it out and I do it again, can I show you?
Please,
so I know exactly
yes.
where. So I know where I'm not supposed to be.
Too high.
And then I'm going to go here,
and
and then kind of scooch you in.
then push on your forehead.
Is that right?
Yep, it looks great. Perfect.
Okay.
Perfect.
Got it.
Yes, perfect.
Gosh. You're putting it in the wrong spot.
And then the other thing you can do is, so you have the head back, and then you can, for at least 1 month, I would work on a little bit to the right.
Okay. I definitely got it from someone that he had adjusted me,
Good.
but he
Didn't know how to.
He didn't necessarily tell me where to find it.
Here you go. Here's a scalpel.
Oh God.
Don't go hacking away at anybody. I was just dirt. I started tattooing myself. This looks good.
Oh gosh, yeah.
It's a powerful tool.
It's a powerful tool, and he just was like, here.
Well, it doesn't look intimidating. It's like, oh.
It doesn't. It's fluffy. It's a cute little cloud.
It'll kick your butt.
Yeah.
Yeah, much better. Wow.
Yeah.
Definitely leveled out.
Amazing.
It's like, it's only
I've had that forever.
very minimal right now.
That's amazing.
Work on your yellow guy, but yeah, it's really a head tilt. It's really, like I said, working on that neck Denneroll that you have properly now.
Dang, it was burned.
I've been doing it, Ed.
Thank you so
Pleasure.
much.
Thanks
Can I
for
give you a
all.
hug?
Yes,
Thank you so
aw,
much.
that'd be great.
Thanks
No,
for all your work. I appreciate it.
Thank you.